What's up, Summit County? I'm Adrienne with Summit County Government, and we're here today talking about public health. It's one of the most important departments in our community, and they have so much going on this fall to help keep you healthy, mind, body, and spirit. And today I have with me Amy Wineland, our Public Health Director, who's here to talk about all of the upcoming programs and existing programs they have going on in our community. Thank you so much for making the time.
Well, thanks for having me today, Adrienne. Thanks so much.
Of course. The first thing I want to talk about, because this just happened in my life, is COVID. And it's flu season as well. So I know that we have a few clinics coming up if people are interested in prevention. Can you tell us a little bit more about these vaccine clinics?
Yeah, absolutely. Well, yes, flu season is upon us. Many people have also heard about a summer COVID wave that is, and we're still kind of coming on the end of that.
Can confirm.
Right now, but we definitely expect a winter wave of COVID as well. So both of these respiratory illnesses can be very severe, can cause hospitalizations and deaths. We actually had more deaths from COVID last year than flu, and so we're not out of the woods by any means. COVID's here, going to be here for a long time. And what's important to know about both of these viruses is that they're escape artists. They're really good at mutating. We talked a lot about mutations during our COVID pandemic, and these viruses continue to do that. And so it's not that we're getting boosters to these illnesses, we're actually getting brand new vaccines because it's all based on what's circulating in the Southern Hemisphere, and we're expecting those strains to be circulating here for us too, and that's what the vaccines are based on. So it's important that people understand these are new vaccines to prevent being sick from new strains of those viruses.
Wow, that's fascinating, actually, because I didn't think that. And maybe some other folks think, I do go every year, but maybe some other folks think, well, I did it already, and I ended up fine, but it's always changing.
It's always changing. And it's also important to note that it's not perfect. And so what we know is that being vaccinated with flu and COVID will significantly decrease people from having severe illness. It doesn't mean they're not necessarily going to get it. Some people won't get it. But what we want to do is make sure that we're protecting those from severe illness, hospitalizations, and unfortunate death that still does occur from these viruses.
I think it's a really good reminder for everyone. We're not quite out of the woods yet on these, and they are annual things that will continue to pop up. And thank you to you and your team for staying on top of it and getting us the best next steps in care. Where can folks go? And tell us a little bit more about where they go, what you can expect when you go to one of these clinics.
Well, first of all, both vaccines are recommended for anybody 6 months and older. And now is the time to make your plans to get both of those vaccines. You can get them both at the same time, which a lot of people don't think that they can do that or know that they can do that, but they absolutely can get them both at the first time. It's important to know that the vaccine will not take effect or give you the immunity that you will need for the season until after 2 weeks of receiving the vaccine. So that's super important. And some people do have some side effects from the vaccine, including some achiness, just not feeling very well. And if you do end up getting the illness right after the vaccine, it's likely that it's because you were exposed before you got the vaccine. It's not from the vaccine. So that's super important. People can take Advil or Tylenol if they are feeling or experiencing these symptoms. What's important to know about the vaccine is that if you have insurance, you are completely covered for these vaccines. And so we're encouraging everyone to go to local pharmacies. All of them are carrying some form of the vaccine, so it's important to call ahead of time to see what age groups they're doing as well as their availability. Some of them will allow walk-ins, but others require an appointment, which you can make online. And then, of course, you can always go and make an appointment with your primary care provider. for public health, our goal and our role in vaccinating is we really are focusing on those who don't have insurance or who are underinsured to make sure that we're providing that access to the community for populations that don't have the ability to get it for free. So we'll be doing that and focusing on that. We are partnering with Safeway this year, which is super exciting.
Very central location in the county, which is really nice.
Yes, they're centrally located, but they're actually going to come out to us. We're going to be going out into the community. What we learned a lot through COVID, we did a little bit before that, but we really need to be and meet people where they are. And so we have some great relationships with our school district. We'll be doing some vaccine clinics at a couple of the elementary schools. Everyone is welcome. You don't have to have kids in that school to attend. I mean, certainly they are welcome, but it's really open to the Elk community members. We're going to be at the Elks community dinner, but Safeway is also going to be partnering with us so that anybody who has insurance can also attend those clinics and be vaccinated.
That's wonderful. What is the cost if you don't have insurance?
It will be $20 for the flu vaccine as well as the COVID vaccine.
Great. That seems like a really easy investment in your health for the future and in the health of others too. Can you tell me, if you were sick already, do you have to wait to get the vaccine? What's the best practice around that?
That's a great question. We're getting that a lot because we do have a lot of folks in our community who have COVID currently or have had it in the past couple of weeks because they've been part of that summer wave. It is recommended that you can actually wait 2 to 3 months before you get your COVID vaccine so that you're protected for the next wave that's certain to come this winter.
Awesome, thank you. Where can people find the dates and locations for these clinics?
Yeah, we have it on our website. We are going to be doing some promotion. You're going to help us with that, of course. Do some promoting on social media platforms. We have it on our website as well. And then parents actually got the information through the school district. So we're grateful of that partnership to get the word out and let people know when those vaccines. These clinics will be all throughout October.
Wonderful. Yeah. Thank you, and to your team and to Safeway so much for helping us keep the whole community safe.
Right. Yeah.
So yes, if you want to know more about where you can find vaccine information, go to summitcountyco.gov and we will list all of the dates and locations there. Now, not just vaccines. You all in public health have quite a few existing initiatives that can help with both mental and physical struggles with addiction. And this was something that we were fortunate to talk with about with your colleague Justin back in August and around Overdose Awareness Day. But really we want overdose awareness to be all year long. And I think one of the cooler things in our community is the outreach that you and your team have done around naloxone, aka Narcan is the brand name of that. Right. Can you tell us a little bit about what we're doing in terms of overdose prevention across the community?
Yeah, so I think it's super important for people to understand, and they've been hearing a lot about this in the news for quite a while, that fentanyl is very dangerous, it's highly addictive, and highly deadly. And we know that fentanyl is being cut into lots of different illicit drugs and pills that look like real pills that people may already have an unhealthy relationship with in terms of a substance. And so it's super important that we're doing this. We know that it's the #1 killer for 18 to 45-year-olds. New research right now actually is suggesting that that age range is expanding to 16 to 50-year-olds. That means that you're more likely to die from a fentanyl overdose if you're within that age group than a car accident or cancer or any other unlikely event that have traditionally been higher causes of death across the country. So we are really doing a lot of work around Fentanyl Awareness Day, or fentanyl awareness, which includes saturating our community with naloxone. Naloxone is an extremely safe antidote to opioid overdose. And it's important that people know that it is safe. It is safe to administer to all ages, even infants or pregnant women. It won't help if somebody is experiencing a non-opioid related overdose. Sometimes people are unresponsive due to cardiac arrest, or maybe they're having a seizure, or it could be to other substance that we don't know what the person was ingesting or taking. Right. But it's not going to hurt them if it's administered. It's super easy to administer. So we really know also from research that communities that saturate their community with naloxone and availability and access to this life-saving drug, that we end up having more people stay alive and hopefully get to resources that they need when they're ready to, to deal with their unhealthy relationship with substances. And so we're super grateful to have the ability to partner with some of our members of our community to provide better access for this life-saving drug. Right now we do have it available at public health and the sheriff's office and the care clinic. But a lot of people don't feel comfortable going to these places.
Which is
or
fair,
they might need this
yeah.
drug after hours or on the weekends where that access isn't available.
So how did you identify other locations where folks could obtain this? How did you work through that process, and where can folks find these vending machines?
Yeah, well, it's a great question. So we've been partnering with folks at the University of Colorado Anschutz Medical Campus, and we were able to do some surveys. We also have our Summit County Overdose Prevention and Education Task Force that we have. Lots of partners are part of this task force and are driving some of this work, including people with lived experience. And those are folks who may have lost a loved one or a child due to accidental overdose deaths, and or some of the people on our task force are in recovery themselves, and so they're able to help us understand more where in our community are people at highest risk. How can we target that young adult population that is at highest risk for overdose? Not intentional overdose, but they might be out at a party, or they might be provided an opportunity to take something that they might not know what's in it. And so we want to make sure that people have access to this drug. So what we did was we were able to collect some data on those with lived experience to identify areas. And we also look at our overdose data and death and where deaths have occurred. 80% of overdose deaths actually occur in the home. 40% of them actually have a bystander who's there present during that overdose. But where people are together and congregating and or outside of their home is where they have to have that access to the naloxone, so they have it at home. So what we're focusing on, at least for the next 2 years, we're focusing on our transit stations. We're focusing on late night bars and restaurants. We're focusing on employee housing and music venues. And so, we have 12 kiosks throughout the community where people can just open a box. Some of them are like a newspaper box. Some of them are wall mounted, kind of like an AED machine, but you can open those freely and access the naloxone.
So, although we do use the word vending machine, there is no cost associated with it, and
Correct.
We want people to take what they need.
Exactly.
Right?
Exactly.
Great.
Yeah.
One of the things that is alarming to me was about the age decreasing. Actually, that age range broadening to younger and younger. How is your department managing that outreach to younger kids in our community?
Yeah. That's such a great question. And again, we're so grateful for the strong partnerships that we have here in Summit County. I think it's why a lot of us who do and live in the realm of prevention love doing this work because we can't do this alone as public health. We need other organizations to help us, to help us amplify the impact and move the needle on decreasing the deaths that we do have here due to overdose. And so the school district is a great example of that. We were able to work with the Board of Education to help change some policies that allow us to come into the schools and educate students on how to recognize an overdose, how to administer the naloxone, but also it's super important for them to know that, we talk about designated driving all the time, and if they happen to be, we don't want them to use drugs. We absolutely don't, but we know that they're going to be presented opportunities to make choices, and we want them to be informed when they make that choice. And so we talk about designated driving, and if they happen to be using alcohol, always have a friend drive them. It's the same now with naloxone, and it's unfortunate that we have to have this conversation, but this is a very serious situation for our country right now, and our youth especially as they're coming into those age groups. And so we're able to come into the high school and middle school and teach the students about this, but also to talk to them to have a designated naloxone administer and have somebody always with you when you might be doing something that isn't healthy and isn't the best choice for you, so that somebody can save a life and recognize the need for that. Yeah.
I think that's really proactive and really smart. We kind of can't bury our heads in the sand when we do realize we have this problem that's community-wide and doesn't discriminate against who it affects. So I think that's wonderful that these kids are getting this education young. I know that I first learned how to administer naloxone when I was speaking with your colleague, Justin. We were at one of the vending machines. Can you give a quick tutorial on how to help someone you might suspect is having an overdose of?
Sure. Well, first, it's important to recognize what an overdose looks like. And a lot of us have had CPR. I know they teach CPR in the high school too. But if you come across somebody who might be unresponsive, sometimes they sound like they're breathing. A lot of people mistake it for the fact that they're sleeping. And we hear this story again and again, that people think they're just sleeping it off. Maybe they're on the couch or something like that. They might hear gurgling sounds, but really that's actually a sign of the body struggling to breathe and have respirations. And so their pupils might be dilated. They might have blue around their lips or fingernails. You want to shake them. You can do what's called a sternal rub. So you make a fist and push pretty hard on their sternum, which really hurts. You can practice it.
Yes, it doesn't tickle.
It doesn't. It's not good. And it's really important that you also call 911 right away, because naloxone, as amazing as it is to reverse an overdose, it only lasts for 30 to 60 minutes. And so that person is and could go back into overdose if they're not going to get the response they also need past that. And so, again, it's a very safe medication. So you are not supposed to be the investigator. You don't have to try to figure out what it is they took. If you see and come across somebody who might be overdosing, give it to them. It's not going to hurt them. And if it is an opioid that they ingested intentionally or accidentally, they will still be alive if you administer that naloxone. It's super easy. I should have brought my practice kit so I could show you. But if you can do this with your fingers, you can administer naloxone. What you do, it's a nasal spray, and so you stick it up somebody's nose and you push, and that's administering the dose. That's it. You wait with them, wait till 911 arrives, and then within 2 to 3 minutes, if they haven't significantly improved, you can administer a second dose. Each kit has 2 doses. And it doesn't matter which nostril you put it in before. You don't have to remember that either. That's what's so wonderful about this drug. But you could administer that second dose and let EMS know when they arrive what you've administered. It's super important to also know that there are laws in Colorado that protect people Good Samaritan laws that protect people from criminal charges if you report the overdose and get help right away. So it's super important. People shouldn't be afraid to act.
Yes.
To save a life, because everybody can save a life. And you might not think you have anybody who's using drugs in your family or in your friend group, but I assure you, if you start having this conversation with people, if you haven't experienced someone who's been affected by this epidemic, you will know somebody who knows somebody. That's how pervasive this is. It's awful. And for the first time in a decade, we've seen overdoses go down. CDC had that report a couple weeks ago. What's important to know is that Colorado is still experiencing increases in overdose deaths, especially due to fentanyl. So we definitely are not out of the woods, and we have a lot of work to do.
Well, thank you for doing this important work. I think it's great that we're able to have these conversations at all ages amongst our community, and thank you for helping to deliver the resources that we need. I want to talk about one more event we have coming up here with Public Health, and we will be right back. Hi, Summit County. It's Adrienne here with Summit County Government, and we're here to talk about a really important event that our Public Health Department has coming up. So I am here with Amy Wineland, our Director of Public Health.
Hello.
Thank you so much for being here.
Thanks for having me.
Yeah, thank you. The work that your team has done in regard to opioid and overdose education has been phenomenal. We've got naloxone vending machines and school resources and educational resources around substance abuse disorder, and also experimenting with opioids and maybe some other drugs that are out there. But we have this event coming up in October for anyone who might be ready to change their relationship with illicit substances or help prevent other folks from obtaining illicit substances. Tell us about Take Back Day.
Yeah, well, first it's important to know that every day is Take Back Day, but we do have days, a couple days throughout the year where we really want to promote and bring awareness to the importance of safely getting rid of and disposing unused prescription medications that we know are in people's medicine cabinets. Too often unused prescription drugs find their way into the wrong hands, and that can be dangerous and tragic. It can lead to substance use disorders and addiction to substances. We know that fentanyl is in lots of illicit drugs right now. But we also know that there's unfortunately a path that continues to happen, and we still hear about it every day, where people are prescribed something that is addictive, and they might not use all of that medication. They themselves might continue using it and become addicted because some of these substances are very addictive, and or there might be family or friends, oftentimes youth, are looking through medicine cabinets for these prescriptions like opioids, any opioids or stimulants. We also, or mood stabilizers as well, can be addictive. And what happens is once those individuals have this relationship or experience what might make them feel good, they might seek it in other areas once that source for them getting it at the home medicine cabinet isn't available anymore. And that might lead them down a path of seeking it in other ways on social media and or from a friend, or which you never know who, if a pill or fake pill that you're going to get is safe. 7 out of 10 pills out there that are bought illicitly that you might think is the real thing actually have a deadly dose of fentanyl in them. And so it's super important that everyone who has these unused prescriptions take advantage of Take Back Day. And now we have one new site of a Take Back box that we really want to promote is the one at the community care clinic. So anybody can go on our medical campus, which is great. We know that a lot of prescriptions are prescribed there. They are on the first floor of the medical office building. You don't have to be a patient. You can just walk in and drop off your boxes in this safe disposal box. And that way we are also protecting our environment, because it's not good to throw them in the garbage or down the drain either.
Them. Yes.
Don't flush
Yes.
them. But it's mostly we want people to remove the access for those drugs being diverted into use that isn't prescribed to that individual. And
That's
so
wonderful.
forth. So we have other locations too.
Yeah, tell us where folks can go around
Yeah.
the community. And again, every day out of the year, right?
Yes.
Pretty much.
But October 26th is a day that we really want to promote. We measure poundage that we get in the boxes, and so it'll be, we really want people to take advantage of that. We have drop-off boxes at the sheriff, at the Justice Center. We have a drop-off box at Dillon Police. We have a drop-off box at Prescriptive Alternatives here in Frisco, and then Safeway actually has a box too. So if you go grocery shopping and you want to get rid of your unused medications, that's also available.
Now, what if you have a medication that maybe wasn't yours? Can you still drop it off at one of these boxes?
Yeah.
Can you assuage folks' fears about dropping medications off?
Yes, it's completely anonymous.
Right.
You just open the box and put it in. And then that box, nobody goes through those boxes. That's also important for everyone to know, is that the bags that are in there already come in a shipping box. And so those organizations that have them are just like closing it and shipping it off right away to where it can be safely disposed of, and getting it out of the hands of people who might misuse or abuse those drugs.
I love that there's no judgment, no punitive damage. So really everyone should be encouraged to drop off their unused medications and prescriptions. Again, a really wonderful aspect of prevention and education across our community. What exactly will be happening on the 26th that we should look for?
Well, we're going to be doing some social media posts, basically, really just encouraging and doing some messaging around a reminder of that people should take that opportunity to look through their medicine cabinet. There is other alternatives. People really feel like they need it or are currently using some of these medications. Some people do have chronic needs for some of these medications that we're mostly worried about, can get a lockbox for their home. And that's available at most pharmacies, but we also encourage that so that, again, it's not available to be diverted or by use of somebody that it wasn't actually prescribed for.
Right, right. Thank you so much. If you are currently having an unhealthy relationship with some of these illicit substances or maybe prescription drugs, what other resources are available to folks in our community?
Yeah, that's such a great question. And as much as we want to meet people where they are, we also want to make sure people understand that we have such a vast array of services and support for people who are ready to take that next step to explore other ways of addressing their unhealthy relationship with substances, and that includes medication-assisted treatment, which we do have. The care clinic is providing that. We have the Front Range Clinic, who's also providing that in our community. We have lots of available scholarships through Building Hope and Mile High Behavioral Health to also provide addictions counseling. We have the Women's Recovery Center in Dillon that also provides a lot of support around this. We have resources of how parents can also talk to their kids on our website. All of these resources are listed on the public health website as well if you need more information. And then we have lots of support groups throughout the community, support groups that are all listed in the daily on a weekly basis of where and when those opportunities are throughout the county.
Awesome, thank you. Another resource I'd like to point our community to, at our transit stations, we do have bulletins that can give you resources for all sorts of things, from mental health treatment to helping you find a job, helping you find food resources across the county. And I'm so glad you mentioned Building Hope. Just at this time, we're coming out of Suicide Awareness and Prevention Month, and really the resources that Building Hope can provide can connect you, if you're struggling a little bit or you know someone who is, can connect you with resources to help get you or that person back on a positive mental health track. And all of these things are really connected. So
Yeah.
I appreciate the way that the community and the folks in it are stepping up to address both mental and physical health. And Amy, thank you so much for what you and your team does. Summit County, for more information, you can go to summitcountyco.gov and always connect with me or with public health, and we will point you in the right direction for resources to help get you what you need. Thanks again, Amy, for being here.
Thanks so much for having me.